I'm your host, Chef AJ, and this is where I introduce you to amazing people just like you who are doing great things in the world that I think you should know about. This show airs live every day at 11 a.m. Pacific time, so please consider subscribing to me on YouTube so you'll always get notified when we have a bonus session, which often happens. You never know. Backed by popular demand, we have board certified dermatologist, Dr. Jessica Krant. There were so many questions last time that we have to catch up. So hopefully we'll get to the ones that were sent in from today as well. Thank you so much for coming back, Dr. Krant.
Thanks for having me. I've been looking forward to it for, the whole month. So I'm excited to be here.
Well, people really enjoyed your appearances and they keep asking to have you back. I know you're very busy because you're a real doctor. And so I appreciate you taking the time to talk to us. So let's get into the questions that we didn't get to last time, okay?
All right.
So this is from Janet. Do you think that radio frequency skin tightening machines are healthy and do they work?
Well, I don't think, radio frequency is an energy. It's just like laser energy or microwave energy, but it's radio frequency waves instead of light waves or microwaves. So it always has the ability to harm us. And it is important to be treated by a board certified dermatologist who's familiar with the device, how deep the waves of energy go, and what specifically that device settings should be. In general, if handled by the right person, I do not feel it's dangerous. But I also don't know that people get the long-term results that they are hoping for. If you go in with low to moderate expectation and may be prepared to do several episodes and several rounds of treatment, then you definitely can hope for some improvement, but I would not like to overpromise.
Right. So you mentioned the word board certified. Why is that important? And are there doctors that aren't board certified? How do they get to be doctors then? So I just think that's interesting because I hear that said a lot. Look for a board certified.
So it's, especially nowadays with so much confusion in the healthcare space, I think that it's valuable to review what all of the terms mean. I'll do a few of them now. We can definitely, I would love to have a more in-depth conversation about this sometime because there's really so much to talk about. But physicians who are MDs or DOs, which are doctors of osteopathy, MDs are what we call medical doctors of allopathic medicine, and DOs are medical doctors of osteopathic medicine. It's two traditions that have sort of merged into an equivalent level of high quality that we call physicians. These people go to medical school that is actually medical school for 4 years to get the MD or the DO degree. And then we all do an internship and a residency training in our specialties. And that for me, that was dermatology. That was 4 years of dermatology training after the 4-year medical school where I got the MD. At the end of the 4-year residency in dermatology, I took a board exam from the American Board of Dermatology. And because I passed that exam, I became board certified by the American Board of Dermatology as a dermatologist. That American Board of Dermatology is one of many specialty boards that are under the umbrella of the American Board of Medical Specialties, which is the ABMS. So when people say they are a board certified such and such, most of the time they are implying that they're board certified by that specialty board that's under the ABMS. Unfortunately, there are now other specialty certifying boards that are not the ABMS, and they have other boards underneath them. So some of them are, a few of them are considered equivalent to ABMS boards, and some of them are standalone and may or may not be rigorous, but there is not a standard to measure them. So board certified dermatologist most of the time means American Board of Dermatology, but not always. It always pays to check and really dig into the credentials.
Wow. Well, thank you. That sounds really interesting because I just always remember you saying that. So when I go to a doctor, I look to make sure they're board
You know,
certified.
I say it because a lot of people say they practice dermatology or they are a dermatologist, but they may not have come through medical school and residency in the field of dermatology. And they can technically practice skincare, but they're not really a board certified dermatologist, and that's the difference.
It's sort of like you have a lot of these beautiful YouTubers that say they're nutritionists, but they're not registered dietitians.
Well, clinical nutrition, master's degrees in clinical nutrition exist, and that's a true master's degree, but it is not the same as being registered as a dietitian, which is the formal practicing license degree. There are people who call themselves dermatologists without even having done any formal dermatology training. So,
Wow. It reminds me of that movie with Leonardo DiCaprio, Catch Me If You Can, where he was all these different professions. He got away with it.
I love that movie. I just watched it again a
Oh,
few
it's
weeks
so
ago.
good. Thank you. So guys, if you're asking questions, I'm sorry, I probably won't be able to get to them. You need to send them in to us. And what that means is if you're on our mailing list, when we send out who the guest is, which we do every day or every couple days, then you just reply because we have many questions from her last appearance and many that were already sent in. So thank you for understanding. Okay, so Tricia says, Dr. Krant's comment on the new research indicating that skin tags might be related to elevated blood sugar really caught my attention, as in the past 2 years, I'm 72, I've begun to grow these, as well as lots more seborrheic keratoses. My A1C is always around 5.3 and my fasting glucose around 85/90, but I wonder if something else like insulin resistance should be measured. I'm normal weight, 5'7", 125, vegan, oil-free, whole food, plant-based 4 years, SOS-free for 2, vegetarian for 40. My dermatologist says all the growths on my body are just part of aging and changes in the immune system, but I'm never inclined just to accept that if there's something I could improve. Thank you, Tricia.
Okay, great question. And I feel it's on the cutting edge of what we're really learning about skin health. And I'm not a primary care doctor, just to be clear. I'm a dermatologist. So I don't really, I'm not an expert on insulin resistance and blood sugars. But I do know that some of the changes of the regulation in our skin cells and skin growths do come from hormonal changes over time and also history of sun exposure. So there are so many factors. Insulin resistance may be playing a factor, may be playing a role also. And it's not a bad idea to look into that as well. But it's hard to say that we could pin all of the little growths on insulin resistance.
Okay, terrific. Thank you. So another question from Janet. What do you think of taking living silica for more collagen production? And what do you think of using silica gel topically?
I don't know any science related to oral ingestion of silica creating collagen. I don't know that there's a connection there scientifically. And as far as topically, that any product with that is probably acting as a humectant, which means it draws moisture from the air and just holds it against your skin because it has a high osmotic cofactor. So I don't think it's triggering the creation of collagen, but I'm sure it doesn't hurt.
Terrific. I've been healed from facial shingles for about 4 months. Occasionally I get a short and tiny tingling sensation on my face in that area, but no recurrence. Is that normal, or do I wait until these sensations no longer happen before I get a treatment of facial PRP for microneedling, with microneedling?
Two separate questions in there. The first question is it normal? It's totally normal. It's called post-herpetic neuralgia. And that means that the nerve, in neuralgia means nerve pain. And after the shingles, which is caused by the varicella zoster virus, which is one of the reason it's called post-herpetic neuralgia is that varicella zoster virus, VZV, it's in the herpes virus family, but it is a cousin of herpes. It is not herpes, but it's under the umbrella of the same family of viruses. Post-herpetic neuralgia is common and normal. It may linger for months to a couple of years, and it may dwindle over time. Whether or not it's safe or will trigger flares to do microneedling or PRP, I don't think we have any science on that. That would be something that you would just decide to wing it and take the risk or wait it out as long as you can.
Great, thank you. Linda says, any suggestions on what questions I should ask when looking for a plastic surgeon to correct my droopy eyelids? There was no medical event, and I am trying to have a board certified plastic surgeon on very soon, a local one to kind of talk about different procedures.
Plastic surgery is a field with many different subspecialties. So I think one of the first things to consider is this a board certified general plastic surgeon? And they do training in facial and body plastic surgery procedures. Is it an oculoplastic surgeon, which is somebody who did training in ophthalmology and then did a fellowship in ocular plastic surgery? Or is it somebody who is a facial plastic surgeon who did an residency training in ENT, which is ear, nose, throat, otherwise known as otolaryngology, and then did a fellowship in just facial plastic surgery? All three of those are types of plastic surgeons that could legitimately do a great job with eyelids. So as long as it's one of those three, I think the next important factor is, can you see photos of some of their results? And the more you can see, the better. Could you possibly speak with some of their patients? Could you ask what happened when something went wrong with a patient and what was the reason for it and what they did about it? There's no substitute for experience and for careful, meticulousness. So other than making sure it's a legitimately trained, appropriate person to do that procedure, I don't think there's any real gold standard. Now, just to throw in there are some dermatologic surgeons who trained in dermatology and dermatologic surgery who also do blepharoplasty, which is the eyelid surgeries. Some of them are excellent, but it would be very hard to be sure unless you similarly looked at photos.
Got it. Thank you. People are saying you answer the questions very thoroughly. And I said, I know, that's why we have her. And I'd go to you for sure if I lived in New York. You don't do telemedicine yet. It's kind of hard with dermatology, isn't it? Do you have to
a couple of factors. I would love to do it in dermatology, and I'm planning to expand my services. But right now I am licensed only to do telemedicine where I have a medical license, which for now is only the state of New York. So anybody who lives in New York, I can do telemedicine for, but so far, no one who lives anywhere else.
Great. Thanks. I wish you lived here. We'd be besties for sure.
On my way. You never know.
There's listen, we have a lot of skin cancer here in the desert, so you'd be very busy for sure.
Well, I'm very flattered. I mean, that would be something to look forward to hang out with you.
Nice. We could do comedy class. Lori says, I have a question about how to layer serums on my face every morning because I am an outside hiker, mountain biker, and I need to use sunscreen. Should I always put my vitamin C serum on before the sunblock so it can soak in? Then after I wash the sweat off my face after hiking, does the water wash off the vitamin C serum? If I put my sunblock on first, then I worry the serums won't soak into my skin.
The rule for the layering of the skin products is always do the thinnest and most watery first, for sure. Because once you put on that thicker sunscreen, nothing's going to get through it. And you're right, this vitamin C will just run right off the outside of the sunscreen. When you rinse your face later, will the vitamin C rub off? Some of it may have been absorbed by then. And, that's the best we can do. It's great to be active and be outdoors. We can only do so much with how many layers we can keep on there and come home and reapply if necessary. But I wouldn't worry about it too much. If you have it on there for a little while, that's doing great.
Nice. Thank you. Susan says, what can we do to prevent milia from forming on our face? And maybe explain what that is, because I don't know.
Actually, there were a couple of milia questions, and I get milia questions all day in the office. Milia, which is the plural for milium, are milium cyst. They're little tiny white balls that look like they're stuck on the skin. They almost look like little white pimples, but you realize that they're not soft like pimples, and they're kind of hard little collections under the surface. They are harmless. We do not exactly know where they come from, unfortunately. It does seem that they are more common now than they used to be in the old days. And it may be that there's some common preservative or ingredient in skin products that is triggering them more often these days. What they really are is sort of a very tiny collection of dead skin cells that gets stuck under the surface instead of exfoliating itself off normally. And so one would think that you can prevent them by exfoliating your face more, but that can also backfire and trigger more inflammation, which will tend to clog pores and may create more milia. So thorough, gentle cleansing, occasional deeper cleansing, light moisturizers, and visiting your dermatologist if these things don't come out by themselves are all good options. If you can't lightly scratch it off yourself by lightly scratching over several weeks to try to get it to release itself, you should come into the dermatologist and we can definitely take care of it for you.
Nice. Thank you. Well, a lot of people are saying that even just when they went plant-based, especially when giving up dairy and oil, their skin improved.
Right. Well, that's my favorite topic to talk about. Plant-based diet. I'm 100% plant-based, as we talked about in our first meeting. It's really full of antioxidants, and it's very barren of inflammatory aspects. So it calms the skin down. It normalizes skin cell turnover. It reduces redness. It actually reduces oiliness, and it may tend to even shrink pore size.
Cool. Well, tomorrow I have on the show Nina and Randa Nelson. They had very, very severe acne, and they're actresses, and they wrote a book about this called The Clear Skin Diet.
Right. Oh my gosh, I'm definitely tuning in.
Yeah, that would be great.
I'm going to learn from them.
Yeah, that's neat. Kathy says, can Botox really prevent wrinkles? And what are treatments for age spots and sunspots?
All right. Botox is what we call a neuromodulator. Botox, Dysport, and Xeomin are three common brand names of the same botulinum toxin molecule, which is deactivated from being a toxin. So it cannot give you botulism and make you sick. But what it does is it actually goes in between the nerve and the muscle, and it cleaves the protein that creates the receptor in the muscle, so that the nerve that sends a signal to the muscle to contract, the signal no longer activates the muscle. So as long as those receptors are dead, that muscle is relaxed and cannot contract. And your muscle recreates new receptors over about 3 or 4 months. So that's how Botox wears off. And the reason that can help to prevent wrinkles or reduce wrinkles is that when your muscles are not able to contract, the skin won't fold over that area. And that is why Botox and Dysport and Xeomin can help to prevent the formation of fine wrinkles over the areas where there's dynamic muscle movement: crow's feet, forehead, frown lines. But as we get older, there's a type of wrinkling of the skin that happens from chronic sun damage, pollution, and just general natural aging. And that is the static wrinkling. That's the kind of crepey wrinkling that happens on the side of the cheek, where it's not about the muscle movement, it's just about the skin quality. So Botox does not help those types of wrinkles.
Wow. It's just aging is not for the faint of heart, is it?
Right. If we talk about it and learn a lot about it, we won't have to go through it.
Guys, we have 7 pages from last time, not to mention the ones that were sent in. So please understand if I can't get to your questions. Also, most of the guests like to see the questions in advance, which is why it's great when you send them in. I've posted the link on how to subscribe to our mailing list so that you can just reply to that. I'm going to get to some of these questions, but one of the things that I keep seeing on the live chat, and I think we should talk about it right now, if you don't mind. Well, a couple of people said that last time you came on, you were going to talk about specific products you liked, so they'd like to know your product recommendations, but also also, we're wearing masks now, or at least most places are, we're supposed to wear masks. So people are asking for tips about that now, because we have something on, or some people, are having them on all day. So how do we make sure our skin stays healthy while we're having to wear a mask?
Okay. The mask issue is very tough. And, everyone's starting to break out now in a pattern that we're calling maskne. We don't really have a magic solution for that. The best I can say is try to take your mask off when it's safe to do it, to let your skin breathe a little bit, and maybe rinse it off a little bit. Don't wear makeup or sunscreen under the mask. If you know that you're going to have the mask on for a long period of time, just do the makeup and sunscreen up here. And, I don't put sunscreen down on my lower face when I'm walking to work. Now I walk 3 miles each way every day to work because I don't want to take the public transportation right now. So I don't put sunscreen under here because I know I'm going to be sweating and it's going to be hot, and that's going to be a recipe for breakout if I had a lot of products and layers on my skin there.
I mean, when I think about it, like I had to go to the dentist and everybody was wearing masks, but they've always worn masks, like ever since I can remember, whether it's the hygienist or the dentist so there's people that are used to wearing masks a lot. So I'm wondering what they have done all these years.
Well, when you're normally the dentist and the hygienist, they're taking them on and putting them off. They put it on for a procedure, they take it off and throw it away. We're in a different world now where we're wearing them all day long, and we're wearing cloth masks and, different materials. Some people have a neoprene, and they're not necessarily very forgiving. The cotton masks are, they collect moisture in there. So it's not like a little thin paper mask that you can easily throw away necessarily.
Do you have a mask recommendation for skin health?
It would be great if I did, but I don't really. I know that there are some masks that they're selling that have fabric impregnated with silver, which is antimicrobial, but I cannot tell you if that makes a difference in acne or skin health.
Great. Thank you. This is similar to a question we had before, but she's having more products. So I know what you're saying. Put the thinnest one on first. Levon says, with order of facial products, when applying multiple moisturizer, sunscreen, primer, when you're putting all that on, does it even work? I mean, like how much can the skin really absorb? Because like when I think about like when I used to wear makeup a lot, like at Sephora, I mean, they're putting like 20 things on. Can all that stuff get absorbed?
Good question. And there's no way to really know unless it's being tested in a lab. And, if it's not being tested in a lab on a live human who has skin on them right now, and then you're taking a piece of it and testing it under the microscope and with special staining, it's almost impossible to know exactly what's really getting absorbed, what's not getting absorbed, how deeply things are getting absorbed, whether they're going into cells. And that is why the field of cosmeceuticals, which are all the anti-aging products that are sold as cosmetics, but claim to do medical things to our skin, is really a big gray area. So there's no way to give a blanket analysis of what is truly being absorbed and what is working. Because if the companies making these products proved that they were going into our cells and doing something, they would be claiming the effect of what the FDA considers to be a drug. And then they would have to be regulated by the FDA. And they don't want to be regulated by the FDA because it's very expensive and much more restrictive. So they're happy to make these claims and do marketing claims to the public in these very carefully worded ways that they say it improves the appearance of your skin without saying it actually changes your skin medically, because they're claiming a cosmetic improvement. They're not claiming a medical functional improvement. And that's where they draw the line between getting regulated by the FTC, the Federal Trade Commission, and getting regulated by the FDA as a drug. So what's getting in? Do the layers block each other? It's all theoretical. And it's just safer to say that the ones with thinner, less occlusive qualities should go underneath first, because once you put a more occlusive product on top, it will do two things. It will block products outside it from getting in, but it actually also helps the products underneath get pushed in. So that's my reason for the layering thinner to thicker going out.
Well, that makes sense. And maybe wait a little bit in between before you put the next layer on.
As much as possible. We don't want anyone spending an hour in the bathroom every morning.
I got to say though, with all the $1 million industries of, products and potions, the diet is the most important. That's what people, we're going to age, and yes, we can have procedures that maybe make us look younger when we're older, but I haven't had any yet. I would love them. I'm afraid of them. I'm so afraid of needles. It's like ridiculous. I still have to get knocked out to get my teeth cleaned. But it's, if you think I look good and you look good, it's because of what we eat. It's not, I believe genetics does play a part, but it's really the diet that makes this, because skin's the largest organ in the body. It would only make sense that would make a difference.
You picked up, I think I said it, and you jumped on it right away when I was on a couple of months ago, and I said, we build our skin from within. I never forgot that. And it really is the key to, everything that I want to teach about. And I'm actually going to be creating a community for education about how all of this, it's in the works right now. Because I feel that you're right. Our skin is our largest organ, and it's also the window to the world about what's going on inside us. And it really reflects not only the health of our skin, but it reflects the health of all of our organs and our mental health, our emotional health. There's a lot of connection between our emotional health and our skin health. It's just a huge field that deserves more research. And what you're talking about when you mention that it's helpful to use good products that are beneficial, and some are proven, but there's just no comparison with putting the right building blocks and materials into our bodies and letting our bodies do what they want, which is to create health and create radiance and create beauty and create our healthy, calm, smooth skin from the inside out. If we don't put any bad things in, our body cannot really make much bad on the coming out to the surface. And you mentioned genetics too. I just want to say we're all born with genes, but anybody who has studied the field of epigenetics, which is the study of the switches that turn the genes on and off, because the genes are just sitting there on this little DNA strand, but epigenetics comes around and decides which genes will be on and which genes will be off. Cancer genes off, anti-aging genes on, and that is all controlled entirely by our lifestyle, by our food intake, by our exercise, by our stress management, by our emotional health, and by, extraneous substances we may put in, carcinogens and pollution and smoking and things like that. So we really have so much control over the health of our skin and our aging.
Right. And if we do damage to it, whether it's through excessive sun exposure or smoking or drinking lots of alcohol and sugar, the potions aren't going to really help.
Well, they're not going to be able to do enough. It's like trying to go forward with dragging 100-pound beanbag behind us. We're just going to be, at best, not getting dragged backwards. But if we can cut that 100-pound weight off of us and let our bodies be healthy, which is what they want, we go far. We can really actually reverse a lot of damage that has already been done if we switch to a healthy lifestyle.
Some of the worst skins I've ever seen are people that smoke their whole life, whether it's a man or a woman. And I don't know, you can't really reverse that damage, can you?
When I was just coming out of all of my training, I'll never forget there was a picture I saw of twin sisters that were older, maybe in their 70s. And one of them had been a smoker her whole life, and one of them had never smoked. And they looked like 30 years apart in age. So smoking is just a killer for the skin and for aging.
Yeah, and it doesn't matter what you smoke, because a lot of people now, well, it's just pot. So, but the whole idea of doing that can't be so good for your skin.
Each substance has its own, pros and cons. Marijuana, THC, and CBD, have some health benefits for some people, but smoking is never our favorite choice for how to take those chemicals in.
I would love to see that picture if you ever could come across it again. I think that would be amazing.
Yeah.
That would be neat. Okay, so we have a question from Jamie in Minnesota, thanking us for all we do. She says, I'm her favorite YouTube channel and refer people here. Thank you. I appreciate that. She says, I'd like to ask Dr. Krant about her opinion on sea moss. I've been making sea moss gel for the past 2 months and feel like my skin is smoother, brighter, and has a more hydrated look. Is this a placebo effect, or are there any scientific data to back it up?
I'd have to look up sea moss scientific research papers, which I have not had a chance to do yet. But I will say that for sure, 100%, it's acting as an excellent hydrator. So even just properly hydrating our skin alone creates a softness and a plumpness and an extra translucency that may not exist otherwise. So as a hydrator, it's like creates a hydrogel, which draws a lot of moisture to the skin surface and can soak in a little bit. It would be excellent. Sea moss, is like seaweed, sea kelp, algae. They have true antioxidants and minerals in there that would be healthy for the skin, and may also have some phytonutrients that are also valuable. So there's definitely no problem with using the sea moss if you think you're getting a good result. And I can try to dig in more to bench research in a scientific lab and see if there is anything that would be available to the public.
Terrific.
Which would be me in this case, because otherwise could be stuff from a cosmeceutical company that doesn't release it to the public.
Terrific. Thank you. So this is from Jean. She says, I know several folks whose, oh boy, they use these doctory words, and hidradenitis suppurativa.
Oh, yeah, you got it.
I don't know what that is, but she knows a lot of people with it, and it's disappeared on a whole food plant-based diet, but she couldn't find any research on this topic. Is anybody researching AS and whole food plant-based? She says, also, I have psoriasis and pustular rosacea, and both have disappeared on a whole food plant-based diet, but I can't find anything in the literature on this. Generally speaking, do you think dermatologists are aware of the power of whole food plant-based, and any suggestions on how to promote more research in this area?
Well, I am one of a few dermatologists who are aware of the value of a whole food plant-based diet. I will admit there are not many of us. They're really a small handful, but it's my mission, along with my colleagues, to educate the rest of us. That's actually what I'm starting to do right now. And I actually just within the past few days came across an article about hidradenitis suppurativa improving with a plant-based diet. I don't remember where I saw it, but it's very early in the recognition of this. And also for rosacea and psoriasis, the word is starting to trickle out. I don't know about large-sized randomized controlled trials that would be in the literature yet, but I do think it's just the beginning of a field that will grow a huge amount in the next 10 years.
Terrific. Deborah says, what are Dr. Krant's thoughts on eczema, particularly a persistent case, even with a whole food plant-based SOS-free diet and using non-toxic, unscented laundry products? Topical steroids are not really an option. Is there any chance that this way of eating can help to resolve pilar cysts, or is surgery the only option? What does she recommend as a non-toxic solution to chapped lips? Lots of questions.
Okay, that's 3 different entirely unrelated subject areas. Let's see if I can remember them.
Okay, well, we'll do one at a time. What do you recommend as a non-toxic solution to chapped lips?
Or I was going to start with that one. purified petroleum jelly, 100% petroleum jelly, which is Vaseline petroleum jelly, I consider to be non-toxic because it's extremely purified over many rounds. But, you know, it is an originally oil-based product. So it was, you know, plants and dinosaurs a long time ago. So some people may not want to use that. Right now, there are some products that are starting to be available on the market made from the castor bean. And castor bean wax is non-toxic and very gentle and very hydrating. So I think that would be a good option. I can't remember the name of it right now, but if you look up castor bean and lip emollient or castor bean emollient, you would find it.
Nice. And then what, is there any way to remove pilar or pilar cysts, or is surgery the only option?
Pilar cysts are like common epidermal cysts that can form under the skin, but they form in the scalp, and they are an abnormal scalp hair follicle that has turned into a little ball that looks like, it actually looks like a chickpea, or, you know, like a little ball there. I don't know of any way to remove them other than making a little opening and taking them out surgically, which I do all the time. It's very quick and easy. I don't know if we can predict them or prevent them. They're pretty genetic as far as I know. It may be that a whole food plant-based diet prevents some inflammatory trigger that may create them, but I don't know if that's the case.
Great. And her last question was a particularly persistent case of eczema, even with SOS-free whole food plant-based and using non-toxic laundry detergent.
Yeah. Eczema is a very complicated and tricky subject. It's really, the term eczema is a kind of a blanket term that can represent an actual very wide range of different skin conditions. It's hard to know without knowing this person, your audience member, if something is happening externally that's creating and perpetuating the eczema and the rashes. I think for sure, whole food plant-based diet is absolutely the way to go, but it's without knowing individually, it's hard to know if there's enough oils in the diet, if the skincare is appropriate, if too much skin cleaning is going on, if too much scrubbing, what the skin products are, whether there's actually an allergy that's happening to a skin product and it's just perpetuating the rashes. It's kind of a long investigative track that we would have to go down to figure it out. But I definitely support a whole food plant-based diet in the beginning of trying to figure it out.
Terrific. Okay. Debbie says, do you have any suggestions for the endless itching and pain for somebody with shingles to speed their recovery? This was for her 82-year-old mother who's suffering.
This is that post-herpetic neuralgia that we mentioned earlier. It can be brutal. It's really a damaged and injured nerve, and it can just be so uncomfortable. There are, you know, a range of pain management measures that range from medications that are prescription medications that reduce the nerve signaling, called gabapentin and other medications, all the way to almost cognitive behavioral therapy techniques for managing the sensation of pain. Physical therapy may help, and even acupuncture and some touch therapies may help to distract or reduce the processing of the nerve pain. It's a tough and wide-ranging issue that can be hard to manage, especially in an elderly person when you don't want to give strong pain medications because it can affect their mental status and ability to take care of themselves. So I would just encourage continuing to visit doctors and asking for help. It's hard to do with things just at home.
Right. Thank you. Robin says, I have varicose veins in my calves. She doesn't have pain, but it's not pretty. Is surgery the only option?
Yes. I would say. I was just thinking, you know, I don't exactly, since I can't picture exactly what they look like, If they're blue veins that are the color blue and they're, you know, even a few millimeters wide to wider, the only way to remove them is really with a procedure. It can be surgical. It can be where endovenous laser, where we would actually put a little laser wand down into the vein and then seal up the vein as we come back out. But it is surgical. They make a little opening. It's really the only way. Any laser is not going to be enough. And sclerotherapy, where we inject a little substance that seals up the vein, that's also not going to be enough.
Yeah, I had mine. I have some in my legs. You know, as a pastry chef, I'd stand all day. And the thing is, the doctor said you can't exercise for like weeks afterwards. And so I just said, forget about it.
Yeah, it's real surgery. And, you know, even before going to that extreme, it's important to start to wear really true compression stockings to prevent it from getting worse and to help support your legs so the blood won't pool in the veins and stretch them out. But so they're cosmetic to a good degree. They're just cosmetic unless they start to hurt or itch, which they can eventually do. And then it's really worth pursuing a procedure.
Terrific. Thank you. And she says there is a dry patch on her nose that is red in color. Could it be sun damage? And is there anything she can do to get rid of it?
A dry red patch on the nose really should be seen by a dermatologist in the office, because it could be nothing. It could be something that can go away with a cream, but it's possible that it's a small pre-cancer or skin cancer. And I could not sit here on this side of a camera without seeing you and telling you any, you know, otherwise. It really should be analyzed by a dermatologist first before we decide on some home treatment.
Great. Thank you. And I think she's watching live as well. So Robin, go get thee to a board certified dermatologist. Annette says, I had eczema on my face when I was a teenager and used hydrocortisone cream for it. It went away during my childbearing years, but now it's back. I get very dry and flaky skin on my nose and in the creases around my nose. Sometimes it's itchy. Moisturizer doesn't help. So I've gone back to using hydrocortisone cream, even though I know how bad it is for the skin. I've been eating 90% whole food plant-based for a couple of years, but 100% SOS free for 2 months now. So what say you?
What say I? Well, first of all, right in the middle of our talk, I really just want to remind everybody and ask for your indulgence, because as a medical doctor, I'm not really allowed to give medical advice to, you know, everybody in the audience. So I'm not giving medical advice. I'm just educating and giving some ideas about some of these things. But I really encourage everybody to see your own dermatologist with some of the ideas that we're discussing and see if that makes sense for you with your own doctor. Now, in response to this question, it's possible that this is not eczema. You know, people call all flaky rashes and dry rashes eczema, but in this description sounds to me like it could be a condition that we call seborrheic dermatitis, which is actually, oh, excuse me, my phone's ringing. I'm so sorry.
That's okay. That's all right.
I wonder if I should go turn it off.
Well, why don't you answer it and let's put the person on.
No, let's not do that, but let me go get it.
Okay, sure. So guys, I just want to let you know that I'm doing a free cooking demo today for a wonderful organization at 1:30 called Get Healthy. They're in Midland. I was supposed to do their event with Dr. Greger and Dr. Stoll, but because of what's going on, it was canceled. So you can actually see it for free. And I have posted a link to where it's at 1 p.m. Pacific time, and I'll post it again. And back to Dr. Krant.
That was my 6-year-old niece trying to FaceTime me, actually from San Francisco.
So oh, that's adorable.
I'll call her back. Seborrheic dermatitis. It's really the fancy medical term for dandruff, and it's extremely common. So, any dermatologist can help you manage it and figure out a plan to keep it away and, you know, prevent it. So I would definitely seek out help in that direction, because it could get you away from needing to use the topical steroids at all.
Very good. You know what I'm thinking is, next time you come on, we don't announce it, so that, because we're probably not going to get to the questions that were submitted yesterday, because we still have a couple of pages, but that might be the way to do it. Okay.
And then maybe we'll try to create a forum where I can just, you know, kind of do it in some other venue too.
So let's see. Lori says, I had a bad reaction to 2 different kinds of tinted mineral sunscreens that are unscented and seemingly free of harsh chemicals. After application, I got small red pimple-like bumps on my face as time progressed. This does not happen when I use my mineral sunscreen at all. Can one develop an allergy to tinted mineral sunscreens? Should I continue to use this product until I build a tolerance? I wouldn't use anything that made me bumpy, I could tell you that.
Yeah, that's a little bit hard for me to really answer. I'm not exactly sure. It sounds like a reaction to 2 new tinted mineral sunscreens, but then I think she's asking, but she says her normal mineral sunscreen, which is doesn't say tinted, doesn't do that. I don't know what brands these are, what products they are, or what ingredients are in them. So it's highly possible that there's something in one or both of the new ones that is a problem for your skin. Or it may be the condition that they got worn in that day. I don't really know. The tinting depends what's creating the tint, and maybe you're reacting to that. I do know that people get allergic reactions to metallic eyeshadow, especially purple. And it's because people react to the small metal molecules in these metallic eyeshadows. So there may be something in the pigment of that tinted sunscreen that's bothering your skin, but I can't really answer more specifically than that.
Thank you. Laurel says, what causes skin sensitivity? Is there something I could eat that would help, or drink that would help with this? I already eat a clean, whole food, plant-based, sulfate-free diet.
Another tough one, that because it's such a general, broad area, it's very, very tricky. Skin sensitivity can be caused by a microscopically damaged skin barrier. So it depends what products are getting put on the outside, how the skin is treated from the outside, what cleansers are being used, what the general habits are in terms of cleaning style, makeup removing style. It's likely that it's not something you're eating unless you're allergic to something that it's a very low level allergy that's creating skin sensitivity. It may just be a little chronic inflammation in the skin that needs some topical anti-inflammatory, but I'm so sorry. It's hard for me to be specific about it because skin sensitivity can mean a lot of things to different people.
Yeah. Well, she says she's been tested for allergies to ointments, potions, and lotions, and she's allergic to neomycin and sensitive to other things. They work for a while, then she gets itchy and rashes. So maybe she needs to find a...
Yeah, it's tough. I mean, that's the kind of thing that can take a really excellent board certified dermatologist months to figure out, working one-on-one.
Great, thanks. Okay, this one is really small, so I got to put my glasses on. This is from Elizabeth. 72, Brazilian, living in Florida. In her youth, spent lots of time in the sun. Has a sister that had melanoma, and uncles and aunts, all kinds of skin problems. Her question is related to all the skin growth there is. You name it, I have it. Last week, I was at the dermatologist and had 2 huge warts removed that were sent to the lab, plus some frozen and others scraped on my face. And she's wondering, are these growths, can they be related to what a person has eaten?
Yes. Any growths can be related to our diet and our lifestyle, because if we have an inflammatory diet or an inflammatory lifestyle, it triggers abnormalities and does not do a good job of preventing and fixing the abnormalities like a whole food plant-based diet does. That said, there's such a wide range of different skin growths that some of them are more triggered by sun exposure, some of them are genetic, some of them are very related to diet or potentially insulin resistance, pre-diabetes, as we've talked about before. And some of them may just be genetic. So I would have to see them to be able to answer more specifically.
Great, thank you. So here's a question from Felicia. Can you please ask Dr. Krant her recommendations for under eye wrinkles? I'm also curious about her feedback on fillers, Botox, and laser procedures to help with aging. I'm about to be 40 and I'm looking for something more aggressive than my current skin regime.
Well, that basically runs the gamut of all of cosmetic dermatology. You know, retinol is the over-the-counter vitamin A derivative that is the over-the-counter version of Retin-A, the classic first ever FDA-approved anti-wrinkle cream. Actually, the only FDA-approved anti-wrinkle cream that exists in the world is tretinoin, which is Retin-A. Retinol is a precursor which works under the skin to have the same effect. It actually makes our cells younger and helps to build collagen. So retinol is a great place to start. Now, if you want to be plant-based only, retinol is a mineral that is made in a lab, but bakuchiol is a plant-derived retinol cousin that research claims has a similar result and is now found in a lot of products. So that's kind of a fun new molecule to look for, bakuchiol. In terms of Botox, fillers, lasers, and peels, they all work. The trick is to find a physician you trust whose style and ideas and aesthetic is like yours and is not going to make you look weird or do too much or hurt you in some way.
Great, thank you. So this question is from Anonymous. I've been hearing recently about some sort of compulsive skin picking disorder. I'm 62 years old, and I think I've probably suffered this for my entire life. Can you shed some light on this disorder and the strategies to beat or diminish it?
Yeah, it's a tough one. Compulsive skin picking. It's a cousin of what we call trichotillomania, which is actually compulsive hair picking. People just pull little hairs out, or they pull their eyebrow hairs out. They don't really realize they're doing it. It's a bit of a stress response, but it's become so ingrained that we don't even realize we're doing it. It's like people who pick at their cuticles or bite their nails. There's a whole science created around trying to help people who suffer from this. And there, I think a big part of a solution could be pursuing some cognitive behavioral therapy or other newer techniques. It's not really therapy in the sense of going back to your childhood and figuring out all of your childhood stressors that are, currently affecting you. It's more like, when does this behavior come up? What are the circumstances? And creating new habits and doing what we call habit reversal training. And it takes a lot of practice, because first we have to become aware. The hardest part is becoming aware that we're doing it, and then wanting to stop, because it's a comfort behavior for people. And it's very hard to get people to really stop if they're just afraid of what life is going to be like without that habit available to them. So a really good cognitive behavioral therapist is really the root of it. People also feel that they get help from maybe hypnotherapy, acupuncture, mindfulness-based stress reduction, and all of these other sort of stress management techniques.
Actually,
sorry. No, I just want to say, please speak to your physician, but there's some people who feel that taking N-acetylcysteine, NAC, can also help with something about the brain signaling that creates this reflexive habit, and that may be a factor in a treatment path forward also.
Yeah, I've actually heard that, and Dr. Doug Lyle might be a person to have a consult with, because in my membership group, Feel Fabulous, where we have one of these broadcasts every Wednesday at 5, he actually talked about trick and some strategies that he knows that could be useful for it.
Oh, so great.
Yeah, terrific. So believe it or not, we just got through all the questions from last time. So now I'm going to get to the ones that came in yesterday.
Exciting.
So we're done with last time. So this is from Leslie, and she says, I'm 65 and noticed from a younger age I didn't seem to have much elasticity in my skin. I know there is sun damage from my younger years, but what concerns me apart from the dry skin is the thinness of my skin. I'm concerned that my skin will be tearing like you see in some people in their 80s. I realize that much of this is probably genetic, but is there anything I can do or use to improve my skin layer? I eat a whole food plant-based diet with no oil or sugar.
Yes. Now, Leslie said she's 65 now, but from a younger age, she noticed her skin being thinner. You know, one of the factors that contributes to this feeling of thinness and dryness and loss of elasticity is lower estrogen. So it's hard to know, but when we women, when our bodies start to lose estrogen, that is a major change that is noticeable in our skin, and it's real. And, you know, if you want to prevent it early on, and you're amenable or interested, you know, it may be worthwhile investigating hormone replacement therapy. But meanwhile, ways to promote an estrogenic effect in the skin now include eating plants with a lot of phytoestrogens, which include, of course, all of the, you know, leafy greens, fruits and vegetables, but especially soy and flax seeds ground up, and whole soy, like soybeans, and maybe some tempeh and tofu, have phytoestrogens that can help to replace some estrogenic effect in our skin. In terms of skin creams, I mentioned a couple of skin creams in a previous talk with you, Chef AJ, there's one called Dermend Fragile Skin Moisturizing Formula. And there's one called EpiMD, which is another cream especially formulated for the skin of older women that contains a lot of ingredients that help to thicken and plump up the skin, and also some ceramides, which are the moisturizing molecule that our skin starts to lose over time. For something that's really easy to get and find right around the corner at the drugstore, the over-the-counter line of moisturizers called CeraVe is really based in ceramides and can really help to replenish some of that lost moisture, especially for women.
That's great. Okay, I think we have time for one more question. And this is from Sherry. And she says, last week I was diagnosed with one small spot of actinic keratosis on my forehead. Can you please give the pros and cons of the two procedures offered? Liquid nitrogen or Effudex cream? All the medical words are just
I was just going to say, Chef AJ, you're doing a great job with all of these.
They make them so hard. They make it so hard to pronounce.
Yeah. Actinic keratosis is a precancerous spot that is, if left to its own devices, might or might not go on to develop into a squamous cell carcinoma, which is one of the 3 types of skin cancer. So we dermatologists, we do like to address and remove those when we find them, just to make sure they're not sitting there able to go on and become skin cancer. The 2 treatments asked about, I'm not going to give any medical advice here. I'm just going to discuss for educational purposes. The liquid nitrogen, which is freezing the lesion, we call it cryotherapy, which means we're freezing it to treat it. Or Effudex, which is a brand name of a cream called fluorouracil cream, 5-fluorouracil or 5-FU. That is, some people may recognize that as the name of a chemotherapy medicine that is given internally for internal cancers. We use it in a cream form in dermatology, and it's very effective because it identifies abnormal cells on the surface and helps to kill them off. It's cytotoxic, so it will find an abnormal cell that is developing with abnormal DNA and abnormal division rate, and it will wage a little battle, make it get scabby, and we hope kill it. So the fluorouracil cream can be really helpful in that way. It can make an area that has a lot of sun damage extremely scabby and inflamed, though. So it's important to go through with your dermatologist about what the plan will be and how to manage if that happens. For some people, it may be an extremely mild reaction, but may still work. So it's important to have a detailed conversation with your dermatologist. It does a really good job of finding bad cells that we don't even notice that are already bad. But it is hard to manage, and it's a 2-month or 3-month course of treatment at home, on and off. So it depends a lot on the social calendar.
Yeah,
The liquid nitrogen freezing is literally just physically giving a little spot of medically controlled frostbite that kills the cells. They blister, they peel off, and hopefully you get new baby skin underneath. If the spot comes back or is not gone, it may need another treatment, or it might need a new biopsy because there may be something else underlying it. One of the downsides of this treatment is that it can leave a spot, a little scar or a little depigmented spot in the treatment area. So pros and cons of both. They each have benefits.
Wow. You know, it's amazing. Like we have different specialties on, but like, for example, for cardiologists, we get a lot of the same questions, but the breadth and depth of these questions, the fact that we've done 3 sessions and that we still have another set of questions for another one, it means you must know a lot. There's a lot of different skin things that people can have.
You know, it's one of the reasons that I just love the field of dermatology is that when I was in medical school, I really loved everything. But dermatology was fascinating to me because not only do we get to take care of men and women and older people and even babies, all ages, we also take care of the toes and the toenails and the hair and the skin all over the whole body. So we're everywhere, fingernails, and the skin represents the health of everything going on inside. So we also have to know if we see certain patterns of rashes, what illness it could represent it from inside, or possibly, I had a patient when I was in my medical training who had a particular famous type of a skin rash. And I knew by looking at her that she had liver cancer. And I mean, dermatology is just a fascinating field in that way. Plus, now we're involved with the immune system of the skin, the microbiome of the skin, stem cell research. There's just, it's really such a wide-ranging field. You're exactly right.
So where can people find you on Instagram? I'll type it again.
Oh, well, yeah, I would love to have everyone follow me on Instagram because that's where I'm going to put my main information about news coming up in the world, and information about diet and lifestyle management with skin health. Right now I'm at Dr. Krant, the Skin MD. It's DrKrant, the Skin MD. But if you search for Jessica Krant, you'll also find me there.
That's terrific. Well, I hope you'll come back, and it's been fascinating. It almost makes me want to go to medical school. It's just so fun talking to you. So
thanks.
A couple of people said you reminded them of Amy Farrah Fowler from The Big Bang Theory.
Right. I can see.
Yeah,
especially with the little dress and the glasses.
Right, exactly.
Yeah. Well, I always have so much fun when I'm here with you too, Chef AJ. Thank you so much.
Well, you anytime. And thank you guys so much for being here. And if you love this subject of skin, please come back tomorrow at 11 when we have authors Nina and Randa Nelson, who are going to be talking about their book, The Clear Skin Diet, and how they reverse their acne with a very specific kind of whole food plant-based diet. And if you're free in an hour, I'm going to be doing a free cooking demo with Healthy City. And I posted the link many times, but here it is again. Thank you again, Dr. Krant. It was so fun talking to you.
My pleasure, as always.